Hello, my name is Noreen Charles, and I will be presenting a presentation on hearing loss, which is a common problem for the elderly. What is hearing loss? Hearing loss is a sudden or gradual decrease in hearing. It often affects the elderly community, and embarrassment, frustration, and risks follow. Statistics. So as you can see on the left-hand side, these are the severities of hearing loss. We have a normal hearing loss, we have a mild hearing loss, we have a moderate, severe, and disabling. As you can see, 74.1% of people have a normal hearing loss, which means in most cases it is treatable. On the right-hand side, we have the different age groups, ranging from age 12 to over 80 years old. And as you can see, as people become near 60, they are at a higher risk for age-related hearing loss. There are three types of hearing loss. We have conductive, we have sensorineural, and we have mixed. On the right-hand side, this is the anatomy of the ear. In the outer ear, we have the pinna, we have the ear canal, and we have the eardrum, or the tympanic membrane. In the middle ear, we have the stapes, we have the ossicles, we have the malleus, the incus, and in the inner ear, we have the cochlea. So as stated before, there are three types of hearing loss: mixed, conductive, and sensorineural. With a mixed hearing loss, the inner, middle, and outer ear are affected. With conductive hearing loss, the outer and the middle ear are affected, and with sensorineural, the inner ear is affected. Audiograms. Audiograms are often presented by the audiologist to their patients after a hearing screening test is performed. So as you can see, we have three types of audiograms here. Each audiogram shows a different type of hearing loss. So in the first one, this patient has a moderate to severe sensorineural hearing loss. And in the middle, we have a mild to moderate conductive loss, and in the last, we have moderately severe to profound mixed hearing loss. So with an audiogram, we have on the left-hand side, we have the intensity level, which is measured in decibels, and on the top we have frequency levels. So this is an easy telltale sign to decide what type of hearing loss a patient may have by looking at their audiogram. Some of the common telltale signs of ignoring hearing loss includes lack of communication, isolating self from society, stress, depression, dementia, and loss of quality in life. Treatment for conductive hearing losses include bone conduction hearing aids, antibiotics, and antifungal medications. Treatment for sensorineural hearing loss includes corticosteroids, hearing aids, and cochlear implants. And treatment for mixed hearing loss includes treating the conductive component of the hearing loss first, and sometimes the hearing aid may be able to help that damaged conductive component. And all of these treatment plans were found on hearingloss.org. There are two types of listening. We have reflective listening and active listening, which is shown on the next slide. For reflective listening, step 1 is to have good posture. Step 2 is eye contact. Step 3 is interaction. And step 4 is tuning into the speaker only. It becomes difficult to pay attention to the speaker when we are presented with environmental sounds, such as a car passing by or other people having a side conversation. So it poses a distraction to the conversation. So it's important that the listener pays close attention to what the speaker is saying. With active listening, more attention is required, lip reading, which makes it easier to understand the speaker if you're unable to hear, focusing on words and sounds, and breaking apart sentences. And never be afraid to ask a person to repeat what they said. With hearing loss comes self-care. It's important to look after yourself, and that includes going to an audiologist's office to follow up with your doctor, routine checkups, and also getting yourself into a routine such as going for daily walks or exercising, support groups, doing your research, relaxation, and hearing aids. It's often shown that people with hearing aids sometimes neglect their hearing aids and don't wear them daily, so it's important that you include them in your daily routine. So, hearing loss is a common problem, and there's always someone out there to listen. Don't be ashamed to tell people you wear hearing aids, and there's always a solution to a problem. Be brave, you are not alone. Thanks very much, and I hope you enjoyed my presentation.